a diabetes hotspot. That's how the Philippines is perceived in the Asia-Pacific region, especially with cases already at epidemic proportions. A study of the International Diabetes Federation puts the tally at 3.7 million Filipino adults with the disease as of 2017. Prevalence is at 6.3%. It also ranks as the 6th leading cause of death in the country, according to the World Health Organization. As the country observes the National Diabetes Awareness Week every 4th of July, has there really been enough education to help prevent the spread of the disease?
On today's agenda, it's all about diabetes. What are the symptoms, causes, and treatments available? It's bound to be a very interesting discussion. Good day, I'm Cito Beltran, and we are One News. This week is supposed to be Diabetes Week, and we have a doctor of medicine for today's Experts and Pros. Dr. Iris Isip-Tan is an endocrinologist, and she tells us about the common misconceptions on diabetes.
A very wise old cardiologist taught us in medical school, the heart of a person with diabetes is like the heart of someone who doesn't have diabetes but has had a heart attack. So really, we need to watch not only the blood sugar, but also the blood pressure and the cholesterol, because persons with diabetes are at an increased risk of heart attacks and strokes. If you have diabetes, you only have to worry about your blood sugar. That is a misconception, because you also have to monitor your blood pressure and your cholesterol levels. Eating too much sugar causes diabetes. Well, it's not that simple. You can get type 1 diabetes because of your genes. You can get type 2 diabetes because of lifestyle factors like not having enough exercise or being overweight. But what does happen if you eat a lot of sweets or you eat sugar-sweetened beverages is that you gain weight. And when you gain weight, that is a risk factor for type 2 diabetes. However, it is possible to have excess weight gain from high-calorie diets that are not exactly high in sweets either. Second misconception, if my wounds still heal, then I can't possibly be diabetic. When you have diabetes, wound healing is impaired when the blood sugar is around 200 milligrams per deciliter and above. It is possible to have diabetes at somewhat lower levels and still have good wound healing.
Thank you, Dr. Iris Isip-Tan. Before we introduce our guests, please join our discussion by sending us your TLCs, tweets, likes, and comments.
Do you have any questions regarding diabetes? Ask our guest doctors. Send us some TLCs, tweets, likes, and comments. Connect with us on Facebook and Twitter at OneNewsPH and use the hashtag Agenda on Signal TV. You can also reach us via text at 0939-369-9194.
On today's agenda, two guests will be joining us as we tackle diabetes. Let's get to know them more.
Dr. Marinelle Bulabos is Medical Director of Family Doc, a community-based primary clinic. She has been in practice for almost a decade. Dr. Mia Fojas is an endocrinologist at Manila Med. She is currently Vice President of the Philippine Society of Endocrinology, Diabetes and Metabolism.
Okay, thank you very much for that introduction. Mia and Marinelle. Mia, you wanted to correct something in the presentation.
No, okay. I'm currently the president of the Philippine Society of Endocrinology, Diabetes and Metabolism.
Okay, so welcome Marinelle, and ladies and gentlemen, there is no beauty pageant among doctors, although we are blessed to have some of the prettiest doctors and more competent. But you know, I'm just trying to lighten it up, but it's a very serious topic, diabetes. What I've discovered is while everybody has heard of diabetes, very few really understand what diabetes is and what it's like to have diabetes. So maybe I'll start with you, Mia, and then I'll go to Marinel.
You know, the prevalence of diabetes is still growing in the country from previously 4.8% a few years ago, and now it's about 6.3% based on the International Diabetes Federation in the Philippines. It's not so much as people do not really probably understand it. It's more of the impact of diabetes on their health. So it's growing, but some people just think about it that it's just blood sugar.
Yes.
So no one really dies directly of diabetes. It's more of the complications related to diabetes and what diabetes does to the other illnesses. Like, it makes things worse. If you have a heart problem, if you have diabetes, it makes it worse. Like, you can have heart failure. You have at a higher risk for blocks in the arteries. So you'll have heart attacks, increases the risk for stroke, even increases the risk for cancers. So that's the impact that diabetes has on the health of a person.
Okay, Marinel, you're with Family Doc. It's a primary care clinic, diagnostic facility. What I'd like to know is, what is it like to have diabetes? I understand there are two types of diabetes, and there is the controllable blood sugar thing. But when you have a serious case of diabetes, what is a patient supposed to be experiencing? Pain, whatever.
Usually, if the patient has diabetes, symptoms are they are always thirsty, hungry. At the same time, they always urinate. So most of the patient also feels polyneuropathy or pinpricks, sensations in their lower extremities or in their upper extremities.
Now, is there pain involved, Mia, Marinel? Because I think that's part of the problem. Most people only react to diabetes only after they've had a sugar shock or whatever you call it, and their wounds don't heal or their legs turn black.
Yes, precisely, because the most common symptom of diabetes is really asymptomatic. So that's why it was recommended, even here in the Philippines, for you to screen everyone, all adults with risk factors, let's say hypertension in the family, etc. You can screen everyone, but 40 years old and above, you have to screen already for diabetes.
Whoa, 4 years old?
40 years old and above.
Sorry.
Screen everyone. Kaya nga, if you take a look at the prevalence of diabetes in the country, it's more of the working class, working people who have been diagnosed with diabetes, because in employment, that's where some of them are get diagnosed with diabetes because of the requirements. So yun lang, because mainly it's asymptomatic, wala silang nararamdaman. And some people, even yung halimbawa, when they go to the ophthalmologist or the OB-GYN, that's the only time that they get screened for diabetes, because there are already complications in the eyes, and then they have frequent UTI or itchiness in the vaginal area.
Marinel started by saying you're frequently thirsty, you urinate a lot, and what is the third one?
You're always hungry.
You're always hungry. Okay, I qualify for all of the above. But that's normal for me at my age. But then you're saying frequent UTI, and then ophthalmologist. What do ophthalmologists discover related to diabetes, Marinel?
Usually, diabetes, ang ina-attack kasi nila is the microvascular. So, yung maliliit na ugat natin sa mata. So, usually, kapag nagkakaroon ka ng diabetes, tumataas yung deposition din ng sugar doon sa mata natin. So, nagkakaroon sila ng cataract, or yun nga, nalalabo mata. At the same time, pwedeng can lead to blindness, pwede magkaroon ng glaucoma. Now,
Mia, you were saying UTI. I never connected diabetes and UTI.
Frequently among women, if you spill out sugar, without the medication, if you spill out sugar through your urine, you are prone to infections already because bacteria love sugar, and so do fungi. So that's that makes them prone to urinary tract infections and gynecologic infections, yung nagkaka-itchiness due to fungal infections. On the retina side, on the eye side, some would actually have their eyes just checked because it's just a routine checkup. Sometimes they even just ask for the grade ng mata. But then again, when the ophthalmologists check for the blood vessels, and then they see that there are tiny hemorrhages, etc., multiple blood vessels, similar to the heart, nagkakaroon ng maliliit na blocks, and then maliliit na blood vessels na mali-mali ang growth. So that's retinopathy. So that's how the OFSA discovered that the patient might have diabetes, and they refer to the endocrinologist or diabetologist.
Okay, pakyawin na natin lahat. As Manny Pacquiao said.
Yes.
Okay, pakyawin na lahat. But, you know, because I remember when I went to my eye doctor, he said, or the optometrician, I mean, he said, no, I won't do your grade until you've seen an ophthalmologist. You go to the ophthalmologist first and then you come back to me, because I want to be sure that whatever grade I figure out matches their grade, but even more important is they find out if there's anything else that's wrong. And quickly they found out there was glaucoma, but you're telling me that an optometrician won't see those early signs. Yes,
these require a lot more in-depth diagnostics, like fundus photo, the fundoscopy, the ordinary fundoscopy, just to take a look at the blood vessels. So usually when you go out there sa optometrist, it's just a grade. So what you are taking a look at is at the medyo harap pa nung mata, whereas the ophthalmologist would take a look at the blood vessels at the back of the eyes. Okay. So it's more than just a grid.
We'll go for a break. When we come back, more on diabetes, lots more to learn about diabetes when we return here on Agenda.
How many people in the world have diabetes? A whopping 422 million. That's according to the World Health Organization. According to studies, by the year 2040, 642 million people will be suffering from this deadly disease if not acted upon quickly. Endocrinologist and internist Dr. Iris Isiptan recommends people, especially at the age of 40 and above, to get screened for diabetes, with or without symptoms.
So we do recommend that you get screened for diabetes at age 40 and above, even if you are not symptomatic, you have no symptoms, because it is still possible. We even recommend getting screened at a younger age if you have other risk factors such as being overweight, sedentary, or having a family history of type 2 diabetes.
According to the World Health Organization, common symptoms of diabetes are excessive urination, thirst, constant hunger, unexplained weight loss, vision changes, tingling or numbness of hands and feet, fatigue, very dry skin, sores that are slow to heal, and more infections than usual.
Okay, Marinel, fatigue, pagod. How do you tell the difference from, you know, getting old or having a rough week to diabetes-related fatigue?
Can I speak?
Yeah, sure.
Siguro, mabilis mapagod, no? Kasi pag matanda ka naman, napapagod ka. It's normal. Yes. Yeah, pero kasi kung bata ka, di ba? Hindi siya normal na palagi kang pagod. Konting ano lang, pagod ka na.
Yeah, if you're 40 years old, and then somebody who's 50 or 60 can play more better basketball than you may have a problem.
Yes.
Okay, now, we have a protest, a howl of protest here in the studio because our editors featured, blessed people. Medyo yung kaming mga pamilya de Bariles. But it's not really, what is significant about obesity in relation to diabetes? Bakit naman yung angka ng mga Bariles ang ginagamit na example na icon of diabetes.
Pero you know what? We cannot judge people na mga ganon, no? But, you know, suffice it to say that a lot of diabetics in the Philippines are really not that obese.
Okay,
no?
okay.
But then, there is such a thing as a hypertriglyceridemic waistline. So, yun yung nagko-correlate sa mataas na risk for heart disease. But, sometimes obesity, diabetes starts with obesity. So, nagkakaroon sila ng mga fatty liver, yung mga insulin resistance ang tawag doon. You have enough insulin in the body, but then it's not entering your tissues, thereby making your sugar shoot up. Insulin is like a key that makes the glucose or sugar get into the tissues to use it up as energy. But then if you are fat, glucose cannot enter your tissues properly. So that's on the side. Among Filipinos, mukha lang tayong lean outside, pero mataba sa loob. So, mas maraming Filipinos actually who are leaner males. Yung mga medyo bigger, more on females kasi.
Okay.
So, we cannot really say that if this person is obese, prone siya sa diabetes. Merong parameters yan. But, obesity is still a risk factor for diabetes.
How many percent, Nel and Mia, how many percent of obese people, or pamilyang matataba, okay, comprise the diabetes population?
Okay. There is no data masyado, but mas malaking 26% of females are obese based on the waist-hip ratio. And less than that, yung mga males, let's say mga about 7% lang. So, meaning, and then the diabetes prevalence in the Philippines, halos equal lang naman ng females sa males. So, it's about 6.3%. So, there's wala pa tayo masyadong data as to how many obese are diabetics as well. Meaning talaga, marami ring hindi obese or lean persons that are diabetics in the Philippines. Okay,
now, Marinel, you said earlier, you gave us symptoms, you know, thirsty, hungry, fatigue, and then you talked about eye problems and UTI, etc. Now, so you go to a doctor, what do you ask for? Because, you know, I've heard of so many tests related to sugar. Pero I get confused because when my wife was pregnant, she had to be tested for sugar, for diabetes.
OGTT.
What
Oral glucose tolerance test.
Yeah, or because if she was pregnant, her sugar level was...
gestational diabetes.
Yun, gestational diabetes. But what sort of test does a normal Filipino go for? To find out, am I diabetic or not? Am I under threat? Nel, Nel muna.
So, in our clinic, we do screening for if you are a pre-diabetes ba or diabetic. So, we do a free screening. So, we do a fasting blood sugar.
Okay, when you say fasting blood sugar, 8 hours, walang kain, walang inom.
Pwede water. Kasi wala namang calories ang water, walang sugar.
Okay.
Kasi 0 calories ang water. Pero at least 8 to 10 hours yung fasting mo.
Okay.
So, usually, we advise the patient na at 12 o'clock or at 10 hindi ka nakakain, pero pwede water, tapos in the morning, ganun din, hindi ka nakakain, and then kukunin yung blood mo.
Okay, and you say you want a blood sugar test, or what?
To know kung mataas ba yung sugar mo sa blood.
Okay, now, Mia, because you are the president of the society, I need, what's the number? Kasi may mga nadidinig ako, my sugar was 120, 300, 400, hello, buhay ka pa. What is the actual, the official or the number? Okay,
for normal individuals, the fasting blood glucose has to be from 80 to 99 milligram per deciliter.
Okay.
100 to 125 milligram per deciliter, that is pre-diabetes.
Okay.
Fasting yan ha. But 126 and above, that is already diabetes.
Okay. When you say diabetes, then they say, Marinel, that just because you are in the 126 and above, that doesn't mean you're insulin dependent, or kasi parang there are two levels now of diabetes.
Usually we can control naman the sugar through oral hypoglycemic agents, no? So ito yung mga metformin.
Yeah, but that's only to bring the number down.
Yes,
okay.
yes.
But you said you're already diabetic when you reach 126 above.
You have to distinguish, ano? Marami namang, there are different types of diabetes. First, we earlier mentioned gestational diabetes.
Okay.
Yan yung mga buntis na usually we maintain them already on insulin.
Okay, buntis po let's be clear, buntis, hindi mukhang buntis.
At mas strict sa kanila.
Pinaparinig of our cameraman here. Okay.
Next would be the type 1 diabetics. These children usually were called juvenile diabetics before, no? But now it's termed as type 1 diabetes. It starts from childhood. They were discovered, usually emergency na yan. May tinatawag na diabetic ketoacidosis, and that's how they get diagnosed, no? Or a child who is not growing properly, laging gutom, ganon. So marami. That is already a juvenile or type 1 diabetic that requires insulin for life.
Is that hereditary?
It's not really. It's genetic. It's sporadic, no? Hindi porket diabetic ang parents, magiging diabetic yung anak, no? Hindi type 1 diabetes.
Okay.
So medyo meron siyang defect. No, may antibodies against the beta cells.
Okay.
So pinanganak na ganon. And then the most common one in the Philippines is type 2 diabetes, which renders a person pwede siyang maging insulin requiring or not insulin requiring. Pwedeng oral anti-hyperglycemic agents.
Yung sinasabi ni Marinel. Okay. Now, let's start with the children. How widespread, Marinel, is the type 1?
How widespread?
Yeah, I mean, is it common or just sporadic, as you mentioned?
According kay Dr. Sporadic siya. Common pa rin sa Philippines is the type 2 diabetes.
So nothing, it's not a cause for alarm. Although you need to be guarded, check your children, etc.
Yes, at least in the Philippines, it's not that common, unlike in Europe and in the United States.
Now, Marinel, how do I know, or are there indicators for a child type 1? Because you said earlier, laging pagod, uhaw, gutom.
Siguro for the kids, no, Doc, correct me if I'm wrong lang, Doc. Sila ay mapapayat, no? Tapos, ganun din, same din na laging gutom. Tama ba, Doc? Or
they have failure to grow, no? So they're not
grow as in growing
height.
Okay.
Height because there's not enough energy, and then failure to gain weight as well.
Although they have an appetite.
They do have appetite.
Okay, so it's if they eat so much and yet don't gain weight and don't grow fast enough.
Yeah.
Okay, then that's a cause for worry.
Yes. And it's life-threatening in some cases, lalo na kung medyo super infant pa, or halimbawa mga toddler stage. Some would have seizures because of the high blood glucose.
Okay, when you say seizures, mild or severe seizures? Epileptic type of seizures. Okay. Yes. We'll go for a break, and we're trying to understand diabetes so that all of you, our beloved viewers, can more or less deal with this problem. It's the number 6 cause of concern in terms of diseases. The common assumption is diabetes is caused by too much sugar, but there's more to that. That's up next. We are One News.
Diabetes doesn't just take one form. It has a number of types. As simplified by the National Institute of Diabetes and Digestive and Kidney Diseases, type 1 diabetes is caused by genetic and environmental factors. Meanwhile, type 2 diabetes is usually associated with lifestyle. Experts say miseducation and common misconceptions about the disease should be corrected, including the correct diet.
It is okay to eat as much fruit as you want, even if you have diabetes. That is also a misconception. Fruit is healthy for you. It has fiber and vitamins and minerals, but it also has carbohydrates. And we do know that if you have too much carbohydrates, it can elevate blood sugar.
Some would say patients may just have a tinge or a little diabetes. There is also a notion that the primary cause of the chronic ailment is excessive sugar intake. But according to doctors, those are just myths, as anyone diagnosed with the disease is at risk of further complications. They also say the culprit are also in forms of genes, poor diet, and lack of exercise.
Okay, you're still keeping track of the day's agenda, which is diabetes, here on One News. I'm Cito Beltran. Okay, doctors, rice. I am the anti-only rice prophet in the studio. How true is it that rice is a factor that causes diabetes?
You like that? Okay. In the Philippines, you have to take a look at the prevalence. The highest prevalence of diabetes happens to be where the rice is grown. So it's a rice granary of the Philippines. That's the highest. But it doesn't, yes. But it doesn't mean that rice is really wrong. It's still a good source of carbohydrate. It has a very kind of low glycemic index, meaning hindi siya ganun kataas, tumataas ang blood sugar mo when you eat it because it gets digested slowly. But if you take it at bigger amounts, that's when it becomes bad for your body.
You know, you're a Metro Manila citizen. You eat maybe what, half a cup of rice or no rice. But most of the guys here eat one palangana of rice. Most Filipino eat one bandehado of rice. Is that lethal? Marinel?
Lahat naman na excessive pangit, diba? Or kung kukain tayo ng too much, kailangan i-burn natin yung sugar na yon. Kasi sugar siya eh. So we burn it. So paano natin siya na-burn? Dapat nag-exercise tayo. Hindi yung sedentary yung lifestyle natin na, halimbawa, pupasok ka sa office, ginagawa mo nakaupo ka lang, diba? Uwi ka ng bahay, wala kang exercise. Kung kailangan mo magpapawis, kailangan mo mag-exercise para ma-burn mo yung kinain mong dami ng kanin and rice.
Yeah, only rice. So you should not persecute Senator Cynthia Villar because she's actually trying to save your lives, you only rice maniac. Okay, so now sugar. Because now there's this thing about soft drinks and
sugar-sweetened beverages.
Yeah, sweetened beverages, and then they're also trying to ban all of these sugar-coated foods in schools. I think when you last guested here with Joy Belmonte, that was our topic. What about those kind of foods?
Okay. Sugar, usually that's it really increases your blood sugar because you just take it in, it is converted immediately to energy if you use it up, if you exercise. Otherwise, it just gets stored as fat. So, similar to the carbohydrates that was, the rice that was mentioned earlier, mas lethal ang sugar-sweetened beverages talaga kasi hindi siya, yun talaga, madedeposito lang talaga anywhere pag hindi mo gamitin. That's what's more important is the balance, I guess. So, if you take in a lot of stuff, you just have to expend your calories through exercise. But if you don't do that, that's when you get to have these complications related to diabetes.
And I don't want to make it sound so elementary, but I think when I compare my generation to the generation of today, I remember in our generation, I think we spent at least 5 hours in the park, in the basketball court. Pustahan namin, we would bet on, okay, one game, Royal True Orange, or Coke, or something, or Sprite. And, you know, you can drink a case of that, but you burned it playing basketball for 2 hours every day, which unlike today, the children don't get any exercise.
Yeah, because they have all of these gadgets with them.
Yeah.
So people are more sedentary nowadays, unlike before, when you are required to exercise even in school. So that's a problem now. So there's a fast life. So everything you have to do the fast food thing because you have to work. And then when you work, you just stay seated. So you expend less calories. And for you to stay up, you take in calories as well. So this is another thing among all employed individuals who are more sedentary than the rest.
I think we should talk to the architects of the Philippines and remove all elevators and escalators. pictures from all buildings, because that's how we grew up. We grew up in buildings that had no elevators. We worked in buildings that had no elevators. We literally had to climb. Okay, now, so sugar, rice, what else is a contributing factor to the evolution of diabetes among Filipinos?
Well, would you like to answer? Okay. Marinel. Okay. Would, among Filipinos, okay. See, another thing is that there's a concept, among Filipinos that the bigger you are, the healthier you look. Even among children, the fatter the child is, the cuter they are. And it's another culture, it's a part of our culture that when we gather together, everyone should eat. All meetings, kailangan may food. All celebrations, food. We gather together for food.
You know, that's true. I have talked to several adults, young adults, and they had, the two common things were, they were all obese, and when I asked, when you were a child, nung bata ka ba, were your parents and your family amused, entertained when you would sit inside the refrigerator and eat inside the refrigerator? You're laughing, but it's true. They open the door, they sit there, and everybody thinks it's cute. They're eating away, and now, 20, 30 years later, they're as big and as wide as the refrigerator. So that's mindset. That mindset na
they're cuter.
Fat is not cute. Fat or big is not healthy.
Yes.
Okay, and later on in life you pay for that.
Yes.
Okay. Well, the question is, I go back to the first question I was asking Marinel earlier. No, what does it feel like? I mean, or what's the scary part about diabetes? I've heard of Gary Valenciano when he was first dealing with diabetes. One day he was walking somewhere abroad and he went into an insulin shock. Or something. But
he's type 1, huh? Type 1 diabetic. It's insulin requiring.
Okay, yeah.
That's why he's it's more complicated. It's more difficult to control. He's lucky that during his time meron ng insulin pump.
Yeah, okay.
So
we'll discuss all of that. We'll continue our discussion after the short break. Agenda will return regarding diabetes. We are One News.
When it comes to medication, Filipinos have wrong practices that can cost healing from diabetes. Top of the list is insulin. Dr. Iris Isiptan says it is not a last resort.
If you are on insulin, you must be dying. That is a misconception I really don't like, because I have patients who are otherwise doing very well on insulin, but as you age, the pancreas can also produce less and less insulin until you need insulin injections. And that's no one's fault. It is not you not having taken care of your diabetes very well. It should not be a judgment. It is just a natural progression of the disease.
Another myth is Filipinos usually stop taking medicines when the blood sugar level becomes normal.
When you're taking your medicine and your blood sugar is on target, that is because of the medicine. The medicine is working. So if you stop the medication, then the blood sugar will start going up again.
Lastly, medicines from diabetes should not be blamed for damages to the kidneys.
Although the #1 cause of dialysis in the Philippines is diabetes, it is due to the complication. So, diabetic kidney disease is a complication of diabetes. Elevated blood sugars for several years damages the kidneys, and that is what causes chronic kidney disease. It is not the diabetes medication itself. I worry about this misconception because many people stop taking medications or take the medications at a lower dose because they think it might harm their kidneys.
Okay, well, I have to say I'm guilty of that in one sense because I have Hepa B and I stopped taking my atorvastatin or some cholesterol medicine because it affects the liver, and then my cardiologist screamed at me and said, you need to take your medicine. Okay, now, so 126 and above, as far as the blood sugar is concerned, you're diabetic.
Yes.
Okay, now, what are the horror stories? Because everybody who has this situation or is in this situation say, oh, it's okay, I'll manage it, may gamot naman. And then they forget their medicine, and then next thing you know, they're in the hospital. What lands a person, a diabetic person, in the hospital, and what are the horror stories? Marina?
Siguro they're not, hindi sila natatakot, no, sa complication ng diabetes. Kasi maraming complication ng diabetes.
Okay.
So, isang complication niya, pwedeng sa puso, pwede kang magkaroon ng ischemia, or pwede kang atakihin doon, no? As well as, pwede kang mabulag.
As you know, I've recently had my second set of angioplasty, and I kept hearing that at the heart center. They were always asking people, are you diabetic, blah, blah, blah. And I say, well, why is diabetes related to it? And then the next one was, you know, what is your, I think, kidney or something function?
Kidney function.
Kidney function.
Yeah, because when you get admitted, let's say you undergo some kind of surgery, like you, when you went through an angioplasty, sayang naman if you don't control your blood glucose, because otherwise, your surgery will not take properly, your wounds will not heal properly, even if you have angioplasty, that will block again because of poor sugar control, kasi it actually increases the risk for inflammation in the area, so magpo-form na naman dun yung cholesterol plaques mo. Sayang naman. Also, it's more expensive to get admitted in the hospital when you have diabetes because, of course, you have to be on insulin, and that renders you more immune compromised, meaning mas high, mas more expensive yung antibiotics, let's say, like those things, because they also have to monitor.
So, if I were actually diabetic, which thankfully, thank God, I'm not, if I were diabetic and I had an angioplasty or a bypass or something, there's a high risk that I won't heal right away. Because me, I was in, out, back at work 2 days later. Most people who are diabetic, Marinel,
they have a poor wound healing.
Very poor wound healing. And then you're saying
recurrence of the blocks, and they're immune compromised kasi.
Okay, so they're susceptible to infection.
Yes.
Because, you know, you have to think in terms of old world language. Not immunocompromised. Infection.
Ayun.
Infection. Okay, now, but you were saying during the break that the cost of medication.
Yeah, it's very expensive.
What are the medicines for the diabetic people take? Kasi tatanda ko si mama noon, you know, she just pop a pill or two. We never really knew the price.
Okay, right now kasi the cheaper medications, right, those would amount to less than 10 pesos per pill.
Okay.
That would also require you to take in more medications kasi it's less effective.
Okay.
And although may cost effectiveness trials, no, good for the masses, but then the better drugs are more expensive because ngayon mas maraming researches na to prove that this might save your pancreas, this might this has lesser side effects, no hypos, yung mga biglang bumabagsak yung blood sugar because of the innovations in research and the amount of money spent on research. The companies have to raise the prices of these medications. Even though, let's say, here in the Department of Health has provided different local health centers with insulin, it's not even enough for a lot of patients in the Philippines because low budget, mas maraming diabetic requiring insulin, ganun na kalala.
Insulin, what's the cost, Marinel?
For the cost?
Well, pag kadasaksak, I'm thinking ganun, I'm thinking like a regular Filipino. If I have diabetes, I have to have an insulin shot once a day?
No, meron pwedeng up to, depending, yes, that's right. It depends on the patient.
Depends kung gaano kataas yung blood sugar mo and yung paano siya i-control.
Okay, let's play out the scenario because I remember during, I'm sorry, my only point of reference was my mother. Okay, she had to do her pinprick blood sugar test every day. And hindi mura yung...
Yeah, the strips. The strips cost more because when you buy strips, you get a free meter, no?
Okay.
Each strip would cost about 25 pesos and above. And then how many times you monitor in a day? Pre-meals, after meals, bedtime.
So 6 kung meals lang. If we're just talking meals, 6 strips.
Actually,
at
3 meals
3.
lang dapat.
Hindi, sabi mo pre-meal and after meal.
Pwedeng may post.
Okay. No, not 6 meals a day. Okay, so that's 75 pesos a day.
Yeah.
And then the insulin, you said how many, as many as how many in a day for the bad situation?
Usually, 2 or 3, Doc, no? Na pag-inject ng insulin.
Okay, and how much is the insulin need?
Oh, let's say, if it's just ordinary, the cheaper insulin, the cheaper insulin kasi you have to inject it about twice daily.
Okay.
So that's about 600 to 800 pesos per vial. So 1 vial would last you dapat 1 month. Kasi after which, hindi na siya pwedeng gamitin. 28 days lang talaga yan once used.
Okay.
However, if you take a look at the better insulins, those are the longer acting ones with less hypoglycemia. It's about 1,400 pesos per pen.
And that's good for how?
And for those who have better glucose control, they can consume 1 pen a month. But for those with the bad ones, it's as high as how many pens in a month? Let's say 6 pens in a month. So 1,400 times 6 pens, ganun ka-expensive na siya ngayon.
Okay, so 1,000, let's say 1,600 average na lang tayo, and then you have 75 pesos a day times 30 days.
Yes.
Okay, Jesper, can you please do the math because I took math 11 7 times. Okay, let's discuss how do we reach out and educate communities to help prevent the spread of diabetes. We discuss that next on the agenda. Okay, we're about to wrap up today's agenda here on One News. Marinel, I understand with the Family Doc you have a program of monitoring diabetes in communities. How do you do it, actually?
So what we do is we conduct community engagements. So we collaborate with the barangay health units.
Okay.
So we do lay forums for the members of communities, as well as educate them on the prevention and determination of diabetes.
Okay, question. Sino ang pasaway? Who are the more hard-headed ones? The one who are in the, low-end financial group or in the private villages?
Pareho.
Okay.
You know what? I encountered such, no? When ito yung mga high-end private. When I told this person that she had diabetes, nagalit sa akin. Because her previous doctor now did not tell her that she was diabetic, and that was ages ago.
Okay.
So they refuse to admit that they are diabetic. There's that denial pa rin.
Okay, the refusal to admit that they're diabetic, is it out of fear? I mean, what is it about diabetes that people won't come to terms with it?
Yes, maybe because para siyang stigma na akala nila mag-i-insulin na sila, mag-i-inject. And you know what? A lot of people don't really want to be maintained on any medication because they want to be seen as healthy.
Okay, but I have actually known of cases who are serious diabetics, went hardcore on their exercise, dramatically lost weight, and didn't have to go back to the medication.
Yes, that's true. There is such a thing as diabetes in remission. But when you are diagnosed with diabetes, know that you are diabetic. And you are just on remission. What does that mean? You can be off the medications if you do exercises. That is really, this is more common in obese diabetic patients. Okay. If you lose a certain amount of weight, nababawasan unti-unti yung gamot until such a time that, of course, you will be off the medication. If you become off off the medication for about 3 months, that may be partial remission. If you become off of it for a year, that is probably remission from diabetes, meaning you're still diabetic, but you have good glucose control.
Okay. Now, Roland Nang, the third, via Facebook, asks us, does this affect the nervous system? If yes, then how?
Okay. For the diabetic patients, there is such a thing as diabetic neuropathy or polyneuropathy. A lot of patients would come in because of numbness of the fingers and toes. Meaning, it's more of the peripheral muna ang affected in diabetes, because those are the smaller ones. The smaller ones get affected due to poor glucose control. Later on na lang yung nagkakaroon ng stroke because of the increased cholesterol levels, because of the poor sugar, could increase inflammation in the blood vessel. So that's a time na nagkakaroon ng bigger blood vessel defect. But mainly, mas maliliit muna. Yun yung sinasabi na glove and stocking. So ibig sabihin numbness sa extremities. Sometimes, merong mononeuropathy. Yung iba, akala nila nag-stroke na sila. Yung pala mataas lang yung sugar, biglang babagsak yung isang mata, hindi nila mabukas. So that is another sign in diabetes.
Not necessarily a stroke.
Not necessarily a stroke.
Marinel, what about those situations? At least 4 times, friends have come to me, Kuyang, what are we going to do about my mom, my dad? The doctor wants to amputate.
The doctor wants to amputate para hindi na lalong ma-infect, no? Kasi pag tumaas yung infection, mas malala yun. So, that's sepsis na.
But what's the connection between that, the infection, inflammation, sepsis, and diabetes?
So, ang problem nga natin, di ba, yung mga nagiging numb o yung nerve, kasi affected din ng nerves natin. So, kapag meron kang maliit na sugat, at iyon gumaling, no? So, kumakalat, nag-i-infect siya to the point na na-infect na rin yung bones mo. Kung sa paa yung sugat na yan, infect na yung bones mo, that's a time na kailangan na siyang i-amputate. So, yun din yung...
Well, I don't want to ruin people's late brunch or breakfast, okay, but that's all the time we have, ladies, and I promise you will be invited yet again. Mia, this is your second turn on the show. Okay, they'll start accusing me of being pro-UP. And that was your first look at the day's agenda. Let me just take this time to please remind you, all you need to do is exercise, monitor your blood sugar, stay healthy, watch your diet. Or else, you could go blind, you could have glaucoma, you can end up with amputation, heart disease, and a whole lot. And that's a lot more money and a lot more pain than you deserve. We care for you. That's why we're teaching you about diabetes. Please don't forget to follow us on Facebook and Twitter at One News PH. I'm Cito Beltran. We are One News.